Knock knock.
Come in.
Good morning.
Good morning.
My name is Kimberly, and today I'm going to be your nurse. Could you just tell me your name and date of birth?
Janice Stevenson, March 31st, 1983.
Okay, I'm gonna see your armband. Okay, I'm going to provide privacy. I'm going to perform hand hygiene. And do you have any allergy that you know
I don't.
of? Okay, what brings you here today?
I want to get a physical exam.
Okay, so with the physical exam, it means I'm going to be looking, touching, and feeling different parts of your body.
Okay.
Okay, so do you know where you are?
Yes, I'm in the hospital.
Okay, do you know the president?
Trump,
Okay, do you know the year?
2020.
Okay, so have you been in under any distress lately?
I haven't.
Been down?
Nope.
Okay, nervous?
Nope.
Okay, so I'm just gonna check your hygiene and it look good. Your dressing and grooming is good. And on a scale on a 0 to 10 scale, how would you rate your pain?
0.
Okay, so I'm just going to start doing your physical exam.
Okay.
Before, I'm going to get your vital sign and your height and weight.
Okay.
And I'm just going to inspect your hair. I'm going to use my pen light. I'm just looking for any lines, lesion, drainage, or anything in your hair.
Okay.
And I'm going to look in your back, side to side, and it looks good. And I'm going to check your facial, just make sure that it's symmetrical, and that it is. And I'm just going to check your temporal, okay, and it is equal and round. And I'm going to look at your trait, and it is midline, okay. And so I'm just going to start with your eyes.
Okay.
And I'm going to use my pen light, and the only thing I want you to do is move your eyes, not your head, okay.
Okay.
So just stay still. Okay, your eyes are round and equal, and they does react to light and accommodation. Okay.
Okay.
And so I'm just gonna look at your eyes, and I'm going to make sure there's no drainage. I'm going to check your sclera. It is white, and your conjunctival is pink and moist. Okay. And I'm just gonna do your sick cardinal gauge. Okay, just your eyes. Okay, and keep your head still. I'm just gonna bring my pen light towards you. Okay, it's all good. And I'm going to start with your ears, okay?
Okay.
I'm just gonna make sure there's no drainage in your ears. Okay, and I'm just gonna palpate around your earlobe, make sure there's no pain, no tenderness, no lesion around your ears, and that is good. And I'm going to look at your carotid pulse in your neck. I'm going to check on both sides, and they're both equal, okay? And I'm going to just look in your nose, okay? Okay, pink and moist, no drainage. And I want you to take one nostril at a time and blow in and out. Okay, looks good and no drainage. So I'm going to start with your mouth.
Okay.
I'm just gonna use my tongue blade, and I'm just gonna look at your tonsils. Say ah.
Ah.
Okay, pink and moist. Your teeth is clean and good. No broken teeth. No you haven't no teeth that are missing. And I'm just gonna look at your hard and soft palate. It is good. Your unival is good. Okay, so could you stick your tongue out? Okay, move from side to side, and it is symmetrical. And so all of that look good with your movement. And I'm going to start with your neck, which I already did, your carotid pulse. Okay, and I want you to do your neck, touch your ear touching your shoulder on both sides, back, down, and look from side to side. Okay, that's good. And so I'm just going to start with your upper extremity, your hands, okay?
Okay.
And so with that, I want you to take your hand and put it over your left shoulder, and your right arm hand over your left. Okay, and that's good. And I'm going to do your hand grip. Just testing your strength. It's a +5. Okay, it's good. And I'm going to check your brachial pulse. Okay, +2 bilateral. And your radial pulse is +2 bilateral. Okay, and I'm going to start with your chest. I'm just looking to make sure that it's symmetrical, and you're breathing in and out. Okay, and I'm going to move this. And I'm going to check your skin turtle. And it is less than 3 seconds. And now I'm going to listen to your lung sound. But first I'm gonna do that excursion, okay?
Okay.
Okay, breathe in and out. Okay. And I'm going to listen to your front side, okay?
Okay.
I'm going to listen to your lung sound. Your upper lobe. This is your right upper lobe. Your left upper lobe. And this gonna be like your middle lobe. Okay?
Okay.
And this gonna be your lower lobe at the bottom. Okay? And could you turn around just to check your back?
Okay.
I'm just checking your back, long sound on your back. Okay, take a deep breath in and out. Okay. Okay. And the lower I go, it will start to fade out. And I'm just going to do the excursion. Breathe in and out. Okay, good. And you can turn around. And I'm going to listen to your heart sound. Okay, I'm start with your aortic. On your right side, your left intercostal border space. And this is your left, your pulmonic. On your left intercostal sternum border. And your tricuspid is your fourth intercostal left sternum border. And this is your mitral, is your fifth intercostal left mid-clavicular line. And I will listen to your apical pulse for 1 full minute. And I hear the S1 and S2 heart sound, which is normal, clear. And on your left side, I'm going to listen to your lateral side. And on your left side, you have 3 lobes to listen to. And on your right side, there is 2 lobes. Okay? On your right side, there is 3 lobes. And on your left side, there's 2 lobes. Okay, and all the sound clear and good. Okay, so now I'm just going to just do your skin. Okay, it's warm to touch. Your capillary refill, less than 3 seconds. Okay, and we did your hand grip and your skin color is good. Okay, now I'm gonna ask you to lay down. I'm gonna check your abdomen. Okay, I'm just gonna look on both sides and I'll go to your foot and I'm just going to like listen to your bowel sound. Okay. I'm going to start with your right lower quadrant, your right upper quadrant, and your left upper quadrant, and your left lower quadrant. All sound good, okay? And I'm just gonna palpate around, make sure there's no tenderness, okay? And it's good. And I'm going to check your lower extremity. I'm just gonna make sure that it's all symmetrical, and that it is. I'm going to check your skin temperature, and it's good. No edema in your neither leg, okay? No excess hair. Warm to touch, pink and moist. And I'm going to check your dorsal and your foot, and they're +2 bilateral. And I'm going to ask you to push down. Okay, foot strength is good. And I'm going to check your capillary refill at less than 3 seconds, which is good. Okay, your nail bed is good. And I'm going to ask you to dangle on the side of the bed. And I'm going to check your DTR.
Okay.
Okay, just relax. Okay, +2, and they are active. And I want you to get up, and I'm going to ask you to walk 5 steps forward and 5 steps, turn around and walk 5 steps back.
1, 2, 3, 4, 5.
Okay, turn around.
1, 2, 3, 4, 5.
Okay, that concludes your assessment. Is there anything else I can help you with?
No.
Okay, thank you.
Thank you.